ever feel like, your body's working against you.
Yeah.
That's kind of what we're talking about today. Diving into this world of autoimmune diseases,
Right.
where your immune system, the body's defense force, kind of gets a little confused
Yeah.
and starts attacking the very thing it's supposed to protect.
It's true. Imagine your immune system as like a guard dog, right? But instead of chasing away intruders, it starts biting like the furniture.
Oh, no.
That's what we're talking about. Conditions like rheumatoid arthritis, lupus, multiple sclerosis, each one, it's like a different way your body's defenses can go off script.
And we are not just, skimming the surface here. We've got a whole stack of medical texts, a bunch of research to really try and, help you understand these diseases, right? How they're similar, how they're different, but most importantly, what you need to know
Right.
to stay informed, to stay empowered.
Think of it as like a crash course on autoimmunity, but without the medical school exams.
I love it. All right, so let's unpack this a little bit. We throw around this term autoimmune disease quite a bit.
Right.
But what's actually happening inside the body when that happens?
It basically boils down to your immune system mistaking your own cells for invaders. So instead of attacking, the viruses and bacteria that are actually harmful,
Right.
it goes after your joints, your skin, your nervous system. I mean, any organ can basically become a target.
So it's like your own immune system kind of betrays you.
Yeah, in a way.
But why would it do that?
That's the million-dollar question. Researchers are still trying to figure that out. Okay.
It's probably a combination of things, right? It could be your genes, environmental triggers like an infection you've had, even something as simple as sunlight.
Wow.
And sometimes, honestly, we just don't know. It's a bit of a medical mystery.
A mystery with real-life consequences, though, for, millions of people.
Definitely.
And just to clarify, when we're talking about something like arthritis, we're not just talking about, your grandparents' aches and pains.
No, definitely not. There are actually different types of arthritis.
Okay.
So you've got osteoarthritis, which is more of a wear and tear condition, comes with age, like you're saying.
Uh-huh.
But then you have inflammatory arthritis.
Mhm.
And that's where the immune system comes in, causing pain, stiffness, and even damage to the joints.
And that's where rheumatoid arthritis, or RA, comes in.
Okay, so RA is our first deep dive. Let's get specific here. What is happening inside the body with this condition?
Well, imagine the lining of your joints like this smooth, slippery surface,
Oh.
It lets everything move easily.
Right.
With RA, your immune system attacks that lining.
Okay.
It's called the synovium.
Okay.
And that causes the inflammation, the pain, the stiffness.
And we're not just talking about a little, morning stiffness here.
I wish it were that simple. Unfortunately, no. Over time, RA can actually cause some really serious damage to those joints,
Right.
leading to deformities, disability. That's why early diagnosis and treatment are so important.
So how does someone even know if they might have RA? Like, what are the red flags to look out for?
One early sign is morning stiffness that lasts for like an hour or more.
Oh, wow. Okay.
Yeah, and you might also notice pain, swelling, tenderness in your joints. And it's often symmetrical.
Okay.
Yeah, meaning it affects the same joints on both sides of your body, so like both wrists, both hands.
Okay, that makes sense. So it's not just one isolated joint that's acting up.
Exactly.
But couldn't those symptoms, they sound familiar.
Yeah.
Couldn't they be signs of other problems too?
Oh, absolutely. They could be.
How do doctors pinpoint it and say, this is RA?
That's the thing. It can be tricky. Doctors use a combination of tools to diagnose RA.
Okay.
So they'll look at your medical history, do a physical exam to check for joint tenderness and swelling.
Right.
They might order imaging tests like x-rays to look for any joint damage.
So it's kind of like putting a puzzle together, it sounds like.
It really is.
Are there blood tests that can help with this diagnosis at all?
There are. One of the key ones is called the rheumatoid factor test.
Okay.
This test basically looks for the presence of specific antibodies in your blood. And these antibodies are often elevated in people with RA.
So if you have those antibodies, it means you've got RA.
Not necessarily. It's not a foolproof test.
Okay.
Some people with RA don't have these antibodies.
Okay.
And others might have the antibodies but never develop the condition.
Wow.
So that's why doctors look at the whole picture, right? Symptoms, medical history, all the test results to make that diagnosis.
It really is like solving a medical mystery. And once you have that RA diagnosis, then what? What's the game plan? What are the treatment options?
Well, the goal of treatment is always to achieve remission.
Yeah.
And what that means is we're trying to reduce or even eliminate the disease activity.
Okay.
That's where medications called disease-modifying anti-rheumatic drugs come in, or DMARDs.
DMARDs.
Yeah.
Okay, that sounds intense.
Yeah, it's a mouthful.
Are these like heavy-duty painkillers or something?
They're much more than painkillers. The DMARDs actually work by suppressing your immune system.
Oh, okay.
So they slow down the progression of RA, and they help prevent further damage to those joints.
So these are like the big guns in the fight against RA.
Yeah, you could say that.
Can you give us an example of like a commonly used DMARD?
Absolutely. One of the most frequently prescribed DMARDs is methotrexate.
Okay.
It's been used to treat RA for decades, and it's often the first-line treatment.
What makes methotrexate so effective for RA?
Well, it works by reducing inflammation, but throughout your entire body.
Okay.
But it does so in this really targeted way that helps slow down the progression of joint damage.
Okay.
It's not a cure,
Right.
but it can make a huge difference in managing the disease.
So it's like taking the edge off the immune system's
Yeah.
attack on the joints.
Exactly. It's like telling the immune system, hey, calm down a little bit.
Right, yeah.
Gives your body a chance to, repair some of the damage.
That's incredible. Are there any, I don't know, important things to know about methotrexate? Side effects, anything like that?
Well, it's important to remember that methotrexate is a powerful medication. And like all medications, it can have side effects.
Here.
Some common ones include nausea, fatigue, mouth sores, things like that.
Hmm.
But your doctor will work with you to manage any side effects and make sure you're on the right dose.
So regular checkups are key here.
Definitely.
Making sure the medication is working and not causing any unexpected problems.
Absolutely. Open communication with your healthcare provider is crucial.
Yeah, I can imagine.
Right.
It's amazing how, medications like that can help manage these really complex conditions.
Yeah.
But it's not just about, popping pills, right?
Right.
What about lifestyle changes? What role do they play in managing ARA?
Oh, huge role. Absolutely huge role. Medication it's crucial, but it's only one piece of the puzzle.
Right.
Lifestyle modifications are like your secret weapon, in the fight against RA.
Okay, spill the beans.
Yeah.
What kind of lifestyle changes can make a real difference?
Well, first and foremost, you've got to listen to your body.
Okay.
You have to give it the rest that it needs. Fatigue is such a common symptom of RA,
Right.
and pushing yourself too hard when you're feeling that way can actually make the inflammation worse.
So it's not about, like pushing through the pain. It's about really respecting your body's limits.
Exactly. And when we talk about rest, it's not just about, getting enough sleep at night, although that's definitely important too.
Right.
But it's also about incorporating rest breaks into your day.
Okay.
Especially, during activities that tend to aggravate your joints.
Makes sense. What else helps besides rest, I mean?
Well, this might sound counterintuitive when you're dealing with joint pain, but exercise. Exercise can be a game changer.
Really? How so? I would think that would make it worse.
I know, right? But it's all about finding the right type and intensity of exercise for you.
Okay.
So low impact activities, we're talking swimming, cycling, even just gentle stretching.
Okay.
Those can help strengthen the muscles that surround your joints, and that can improve flexibility, reduce stiffness.
So it's like giving your joints some support.
Exactly. A little TLC for those joints. And, don't underestimate the power of a healthy diet.
Oh, right. Of course. Yeah.
Yeah. There's some evidence that certain foods can actually fight inflammation.
Interesting.
So loading up on, fruits, veggies, omega-3 fatty acids, that can be really beneficial.
It's amazing how interconnected everything is,
I know.
Diet, exercise, rest, it all plays a role.
It really does. It's a holistic approach, right? And remember, it's always best to talk to your doctor or a physical therapist before starting any new exercise plan.
Oh, for sure.
Just to make sure that it's safe and effective for you.
Great advice.
Yeah.
Okay, let's move on to our next autoimmune condition, which you mentioned earlier can be kind of a chameleon, lupus.
Yeah.
Why do they call it the great imitator?
Lupus is so tricky because it can affect pretty much any organ in the body.
Really?
Yeah. And its symptoms, they can vary so widely from person to person.
Yeah.
That means it can basically masquerade as a whole bunch of other conditions.
Oh, wow.
makes it tough to diagnose.
So it's like lupus is playing hide and seek with doctors or something.
Kind of. Like someone with lupus might have, say, fatigue, joint pain, skin rashes, which, those could be mistaken for other autoimmune diseases like RA.
Right.
But they might also have kidney problems, chest pain, even neurological symptoms, which could point to a whole other set of conditions altogether.
Wow. That sounds incredibly frustrating for both patients and doctors.
Oh, for sure.
So what are like the telltale signs that it might actually be lupus causing these issues?
One of the classic signs of lupus is this butterfly-shaped rash that appears across the cheeks and nose.
Oh, yeah. I've heard about that.
Yeah,
It must be really tough to deal with such a visible symptom.
absolutely. It can have a real impact on people's, self-esteem, their quality of life.
Yeah.
But it's important to remember that, not everyone with lupus will get this rash.
Okay.
And even those who do might not have it all the time.
So it's not a guarantee, but it's definitely like a red flag.
Yeah.
If someone has that distinctive rash,
Yeah.
you mentioned earlier that lupus can affect the kidneys.
Right.
What's happening there?
The kidneys are one of the most common targets of lupus, unfortunately.
Okay.
When the immune system attacks the kidneys, it can cause inflammation and damage.
Okay.
And that can lead to a condition called lupus nephritis.
Okay, we're getting a little technical here.
Sure.
What exactly is lupus nephritis, and why is it so concerning?
Well, in simple terms, lupus nephritis is just inflammation of the kidneys, but it's caused by the lupus.
Okay.
And it can range from, mild to severe.
Okay.
And in some cases, it can actually lead to kidney failure. So
That's serious stuff. How is lupus nephritis treated?
usually, treatment involves medications that suppress the immune system and reduce that inflammation in the kidneys specifically.
Okay.
Early diagnosis and treatment are super important for preventing any long-term damage there.
So if you suspect you might have lupus, it's crucial to see a doctor, get tested.
Yeah, absolutely.
You mentioned kidneys. What other organs are commonly affected by lupus?
Well, in addition to the kidneys and the skin, lupus can affect the joints, the heart,
Oh, wow.
the lungs, the brain, the blood vessels.
It really is a whole body disease then.
Yeah.
What are some of the common symptoms people experience when those other organs are involved?
Well, when lupus affects the joints, it can cause, pain, stiffness, and swelling.
Okay.
Much like RA, actually.
Right.
But with lupus, the joint pain tends to be less severe, and it's less likely to cause, actual joint damage.
So joint pain, kind of a common thread between RA and lupus,
Yeah,
but the severity and long-term effects can be quite different.
exactly.
What about the other organs? Like what kinds of problems can come up?
Well, heart problems are another concern with lupus.
Okay.
The inflammation can actually affect the lining of the heart muscle itself, even the blood vessels that supply the heart.
Wow.
This can lead to chest pain, shortness of breath, and in severe cases, even heart failure.
Lupus sounds like it can be a real roller coaster for people
It definitely can be.
with so many different potential complications.
And the unpredictable nature of the disease, too, right?
Right.
With the periods of remission and then these flares.
Right.
It can be really challenging to manage.
Speaking of challenges, what about treatment options for lupus in general?
Sure.
Are there medications that can help manage these wide-ranging symptoms?
Well, there's no cure for lupus, unfortunately.
Oh.
But there are medications that can help, control the disease activity, reduce symptoms, and hopefully prevent organ damage.
So similar to RA, it's about managing the symptoms, trying to prevent those flares, and just protecting the organs from any long-term damage.
That's a great way to put it.
Okay, good. And what are some of those medications? Are there any specific ones that are commonly used?
One of the most commonly prescribed medications for lupus is called hydroxychloroquine.
Okay.
It's also known as Plaquenil.
Plaquenil.
Yeah.
Okay. That name rings a bell. Wasn't Plaquenil in the news a lot recently?
It was, yeah. It received a lot of attention during the COVID-19 pandemic.
Yeah.
But it's really essential to clarify that its use for lupus is well established.
Okay.
And it predates those events.
Right. Important to separate those two things.
Exactly.
So back to Plaquenil for lupus.
Sure.
How does it actually help manage the disease? How does it work?
Well, it's thought to work by kind of calming down the immune system,
Okay.
reducing inflammation throughout the body.
Okay.
And it can help with a wide range of lupus symptoms. Joint pain, skin rashes, fatigue. It's pretty versatile.
Sounds like it. Are there any side effects or, I don't know, things people should be aware of if they are prescribed Plaquenil?
Like all medications, it can have side effects, but most of them are mild and temporary.
Okay, that's good.
One thing to definitely watch out for, though, is potential eye problems.
Okay,
So regular eye exams are super crucial for anyone taking this medication long term.
good to know. So regular monitoring, key here, just like with RA.
Absolutely.
Makes sense. Makes sense. It seems like with these autoimmune diseases, staying informed, being proactive, that's key.
Absolutely.
But before we move on from lupus completely, are there any lifestyle changes that can help manage the condition, like we talked about with RA?
Oh, yeah, for sure. Lifestyle plays like a huge role in managing lupus, just like it does with RA. One of the most important things is sun protection.
Sun protection, really? Okay. Why is that so crucial for people with lupus?
Well, for people with lupus, exposure to sunlight can actually trigger flares and make their symptoms worse.
Wow.
It's called photosensitivity.
So it's not even just about, trying to avoid a sunburn. It's about managing the lupus itself.
Exactly. We're
Okay.
talking like hats, sunscreen, sunglasses, the whole 9 yards.
Wow, cool.
Even on cloudy days. And, because skin is often affected by lupus, gentle skincare is also really important, using mild products, things like that.
So sun protection and skincare, those are must-haves for anyone with lupus.
Definitely.
Got it. Okay. Ready to tackle our last autoimmune condition for this deep dive.
Let's do it.
Okay. So we've covered RA, which, centers on the joints.
Right.
We talked about lupus, which can, affect a whole bunch of different organs.
Right.
Now we're moving on to multiple sclerosis or MS, which sounds like it targets a completely different part of the body.
You're right. Our focus shifts now from the joints and organs to the nervous system.
Okay.
So imagine your nerves are like these electrical wires, right? Sending signals throughout your body.
Okay. Yeah.
These wires, they're coated in this protective layer called myelin. You can think of it like insulation that helps those signals travel really quickly and smoothly.
Okay, so the myelin sheath helps our nerves communicate efficiently.
Exactly.
What happens in MS? Does something go wrong with that insulation?
Exactly. In MS, your immune system, it mistakenly attacks that myelin sheath, which disrupts those nerve signals.
Oh, wow.
So imagine like you're stripping the insulation off those electrical wires, right? You might get cross signals, short circuits, or even no signal at all.
So instead of smooth communication, you get all these like neurological glitches. That sounds like it could cause a whole range of problems.
Yeah.
What are some of the most common symptoms of MS?
Well, you're right. MS can manifest in so many ways. Some people experience fatigue. And we're not talking about just being tired here. We're talking like severe fatigue that interferes with their daily life.
Oh, wow.
Others might have muscle weakness or spasms, making it really hard to walk or even like hold things.
Right.
Numbness, tingling, vision problems. It really just depends on which nerves are affected.
It sounds like a very unpredictable disease
It really is.
with like such a wide range of potential symptoms.
And to make things even more complex, MS can actually present in different forms.
Really? Yeah.
Yeah. So some people, they have what we call relapsing remitting MS, where they experience these periods of relapses where their symptoms flare up, followed by periods of remission where they feel relatively well.
Yeah.
Others have a more progressive form of MS, where their symptoms just kind of gradually worsen over time.
So it's not a one-size-fits-all kind of disease at all. Are there any symptoms that are more common than others? Or does it truly just vary, like completely from person to person?
It's interesting you asked that. While MS can be super unpredictable, there is one symptom that's almost universal: fatigue.
Really? Even more common than the physical limitations like the muscle weakness and things?
You bet. And it's not just your average, oh, I'm a little tired kind of fatigue. We're talking overwhelming exhaustion that can make even like the simplest tasks feel impossible.
I can see how that would be, truly debilitating.
Yeah,
Especially if other people don't always understand what you're going through.
exactly. And unfortunately, fatigue is often overlooked or even dismissed in MS, which makes it even more challenging for people living with the condition.
That makes it even more important to talk about it then. Right?
Yeah,
Raise awareness so people understand, how debilitating it can actually be.
absolutely.
So if someone is experiencing these symptoms, fatigue, muscle weakness, the vision problems you were talking about, how do doctors even begin to diagnose MS?
Well, it can be tricky because, like we've mentioned, those symptoms can can mimic so many other conditions, right?
Right.
There's no one single test to diagnose MS. Usually doctors start by taking a really thorough medical history, doing a neurological exam, and then they'll often order an MRI.
An MRI, that's the scan that gives you those really detailed images of the brain and spinal cord, right?
That's the one.
What are they looking for on the MRI?
Well, with MS, the MRI can often reveal lesions or scars on the brain and spinal cord.
Okay.
And these are basically just areas where the myelin has been damaged.
So it's like looking for those spots where the insulation on the wires has like worn away.
A good way to think about it, yeah.
Okay. Once MS is diagnosed, then what are the treatment options? Is it similar to RA and lupus, where the focus is on managing symptoms, trying to prevent those flares?
You're on the right track. Treatment for MS, it focuses on 3 main goals. Managing those symptoms, of course, we want to reduce the frequency and severity of those relapses if someone's having them.
Right.
And then slowing down the progression of the disease itself as much as possible.
So it's a multi-pronged approach.
It is.
What types of medications are used to kind of achieve those goals?
Well, one class of drugs that can be really helpful for managing those relapses is corticosteroids.
Okay.
You've probably heard of those.
I have. Yeah, I think so.
They're powerful anti-inflammatories, and they can help reduce that inflammation in the nervous system, shorten the duration of those relapses.
Corticosteroids, those are often used for like allergic reactions and other inflammatory conditions too, right?
That's right. They've got a wide range of uses because they're so effective at bringing down inflammation really quickly.
Got it. Got it. What about slowing down the progression of MS, though? Are there medications that can do that?
There are. They're called disease-modifying therapies, or DMTs for short.
Okay.
And these medications work by kind of modulating or adjusting the immune system.
Okay.
So that it reduces its attacks on that myelin.
So it's about like calming down that immune system overreaction, essentially.
Exactly. DMTs, they can't repair the damage that's already been done,
Okay.
but they can help prevent further damage and slow down that progression of disability in many people.
That's incredible. It seems like there have been so many advancements in treating autoimmune diseases, even in like recent years.
Oh, it's true, yeah. And the research continues, which is really exciting for people who are living with these conditions, for sure.
Absolutely.
Yeah.
And speaking of hope, what about like, those non-drug approaches that we talked about for RA and lupus?
Yeah.
Do lifestyle changes also play a role in managing MS?
They do. Big time. Regular exercise is so important, maintaining muscle strength, flexibility, and balance, all of which can be affected by MS.
What types of exercise are best for people with MS?
It really depends on the individual and their specific abilities and limitations, right?
Of course, yeah.
But low-impact activities are often a good place to start. Things like swimming, cycling, yoga, tai chi,
Okay.
because they're gentle on the joints.
Makes sense.
But again, it's always crucial to work with your doctor or physical therapist to create a plan that's safe and effective for you.
Customized care is so important. What other lifestyle changes can make a difference for someone with MS?
Stress management. That is huge.
Oh, yeah, of course. Stress.
Yeah, stress can trigger those MS flares, makes symptoms worse.
Wow.
So finding healthy ways to manage stress, whether it's meditation, deep breathing exercises, spending time in nature, talking to a therapist, can be so beneficial.
It's amazing how interconnected everything is, right?
I know.
Our physical health, our mental health, our environment. It's not just about, treating the disease itself. It's about taking care of the whole person.
You said it. It's about empowering people to live their best lives, even with a chronic condition like MS.
Okay, we have covered a lot of ground today. We've been diving deep into these 3 complex autoimmune diseases, RA, lupus, and MS.
It's been fun.
Before we wrap up, though, let's kind of connect the dots here. What are the key takeaways, the big picture things that, our listeners should remember from all of this?
Well, one key takeaway is that while RA, lupus, and MS affect different parts of the body, right?
Right.
The joints, multiple organs, the nervous system,
Yeah.
they all share this common thread of autoimmunity, which means that immune system is mistakenly attacking the body's own tissues.
Right. It's like they're all branches of the same tree with autoimmunity as the root.
Exactly. And because of that shared root, they also share some commonalities in terms of symptoms.
Okay.
Fatigue, for example, that's a hallmark of all 3.
Yeah, we talked about that, yeah.
Yep. And they often share those risk factors too, women being more susceptible than men.
So there are some definite overlaps.
Sure.
But we also talked about how each condition has its own unique characteristics and challenges.
Yeah.
What's What's the most important message that you want our listeners to take away about, navigating the world of autoimmune diseases?
I think the most important thing is to be your own advocate.
Yeah.
If you're experiencing, unusual or persistent symptoms, don't wait. Don't hesitate to seek medical attention.
Don't just brush it off, hope it goes away on its own.
Exactly. Early diagnosis and treatment are absolutely crucial for managing these conditions
Okay.
and for preventing that long-term damage that we talked about.
So knowledge is power.
Absolutely. The more you know about your body, the more you know about whatever condition you're facing, the better equipped you are to make good decisions about your health.
And never underestimate the power of, connecting with others who understand what you're going through. Support groups, online communities, all of that. Those connections can make all the difference.
I couldn't agree more. Yeah, it can be so validating, so empowering to connect with others who truly get it.
This has been an incredible deep dive. We've learned so much about these really complex conditions,
We really have.
but more importantly, how people can take charge of their health.
Absolutely.
So thank you for joining us on this journey into the world of autoimmune diseases. Until next time, stay curious and stay well.